habits. Today, I am going to discuss nocturnal enuresis or bedwetting and its homeopathic solution. Now, what is nocturnal enuresis? Nocturnal enuresis or bedwetting is nothing but the passage of urine involuntarily during sleep. It is more a symptom than a disease. It is not life-threatening, but it compromises with the personality of the patient, and also it becomes a social stigma. It is too much common in early childhood and also in advanced age or old age. But when it continues in the later childhood and in the middle age, it is very disturbing to the patient. So, utter importance should be given by the homeopathic physicians to treat the disease and hence relieving the patient from this disturbing symptom. Now, some methods of practices should be followed by the patient along with medication. Number one, lifestyle modification. The patient should be advised to restrict fluid intake before bed and also not to take alcohol or coffee and to manage constipation by taking those foods which is rich in fiber. Number two, pelvic floor exercise. Pelvic floor exercise helps to strengthen the muscles of pelvic floor and hence it helps in regulating the urinary system, which is mainly seated in this part. Now come to medication or medicines. Number one, causticum. Causticum is a good medicine which is frequently indicated to treat this disease. Symptoms are involuntary passing of urine in the first part of night, and when the patient sneezes or coughs, the urine dribbles from the patient's urinary bed, and the involuntary passage of urine in case of causticum also happens due to sudden joy or sorrow or fear also. The patient does not have any sensibility of passing urine. But we know that in homeopathy, there is no specific remedy for any specific disease. The symptom similarity is the only means to treat in the homeopathic mode of treatment. So, the supporting symptoms of Costigan should be taken into consideration. The supporting symptoms are: number one, the patient does not like sweets. Number two, patient is fond of salt and meat, and there may be history of mortification. And as it belongs to psychotic dyscrasia, so what's may be there in the face or any region of the body. Now come to pulsatilla. Pulsatilla is also a very good remedy which is frequently indicated to treat obesity. Its symptoms are like Costigan, it has also involuntary passage of urine or passage of urine while coughing and laughing. But I have seen that in some patients, especially in children, involuntary passing of urine also happens spontaneously and it wears the undergarment while having. And in this case, I have used pulsatilla in many times and have obtained good results. Generally, the bed waiting happens in the first part of night. The supporting symptoms are: number one, the patient is cool tempered or calm temperament. Number two, patient is fond of fatty food and tolerates it well. Number three, crying disposition. Patient prefers open air, and when the subject is female, the mens is delayed, scanty, and the menstrual flow is intermittent, and there is dysmenorrhea, that is painful menstruation. The patient is too much sentimental, and when consolation is given, the patient is relieved. Now come to creolode. Creolode urine is too much offensive. Generally, its bedwetting happens in the first part of night. The patient is in deep sleep. Even after bedwetting, it is very difficult to arouse the patient. And there is a striking feature of the zone that when urging comes, the patient is compelled to go at once to the washroom because he cannot tolerate the urging at all. Now come to Sina. Sina is also a good medicine to combat the disease. Sina patient is too much cross. Patient wants many things but rejects everything when offered. Rubbing of nose is there, and picking of nose is also a characteristic symptom of Sina. The tongue is clean, patient has voracious appetite, and fond of sweets also. And the bedwetting happens in the first part of night generally. Now come to CPL. The urine is CPL. The urine of CPL is also very filthy, very bad odor. CPL urine has precipitate which adheres to the vessel wall, and generally the bedwetting occurs in the first part of night. Now come to benzoic acid. Benzoic acid urine is also very disagreeable odor, very bad odor, and it is filled with uric acid. There may be pain in various joints, and generally it occurs in cold. There may be involuntary dribbling of urine. Now, those are oxidated. As we know that in homeopathic Mejia medica, Uza is our great antipsychotic medicine. So, when psychotic dyscrasia, psychotic symptom is there in the patient, Uza may combat the disease. As for example, a patient who is suffering from nocturnal enuresis and having warts or excrescences in various parts of body. The patient is chilly, the skin is oily, and the family history also indicates psychotic dysprasia. The patient is to much extent fatty degeneration. Then, if administered, we will get brilliant and permanent result. Now come to sulfur. Sulfur is also a very deep acting medicine, and we may combat the disease that is bedwetting with the administration of sulfur. The symptoms are the patient is scrofulous, that is, some maxillary glands are swollen or tender. Number two, patient is hot, fond of sweets, history of skin disease suppression, suppression of skin disease. Patient cannot stand for a long time. Patient is not disturbed by uncleanliness, and the various orifices are too much red. If the disease picture of the patient corresponds with these symptoms, then sulfur will be a good medicine to combat the disease. Now come to Ras aromaticus. Ras aromaticus mother tincture is also a good indicated remedy to combat nocturnal enuresis. The symptoms are severe pain at beginning or before urinating, causing great agony in children. Now come to equiditum hyomet. Equiditum has severe dull fate and feeling of fullness of the bladder. The patient tries to urinate, but the urine comes drop by drop. And there is burning pain at the close of urination. Urine flows only drop by drop. Incontinence in children with dreams of nightmare when passing in cornea maculatum. Cornea maculatum is indicated especially in old person who dilutes urine involuntarily due to weakness of nervous system. That is nervous weakness. Its characteristic symptom is the flow of urine is intermittent. It is mainly indicated for dribbling in old men. Clematis. Clematis is also an important remedy to be administered for this disease. Its symptoms are also as like as spudium, intermittent flow. That is, the flow starts, then it stops. And its another featuring, there is pain in the testes, that is arthritis. So, is the bedwetting or nocturnal enuresis is accompanied by arthritis or pain in the testes and sometimes involuntary dribbling of urine during the week, we may use clematis. Thank you, friends. Have a good day.